4,000 new COVID cases have triggered Chicago to ban all indoor bar and restaurant service in the city. Nationwide, the virus is now blamed for more than 226,000 deaths. 917 of those deaths have been reported in the last 24 hours. In South Dakota, nearly half of the state's prison population of 3,300 inmates has tested positive for COVID-19. And public officials across the country are already trying to slam the brakes on holiday celebrations. Illinois' top health officials warn that if you want to see your loved ones alive at Christmas, don't see them on Thanksgiving. Similar warnings are coming from leaders in Philadelphia and New York City. It comes amid new worry at the nation's hospitals. Earlier, I spoke with Dr. Imran Ali. Good morning, Dr. Ali, and thank you for joining us. Let's begin with what hospitals are seeing right now. About 20% of them across the country are running short on ICU beds. How's that compared to the last coronavirus surge that we saw over the summer?
Well, Mona, this time is a little bit different because now the workers in the ICU are affected. We've been doing this for about 7 months now, and basically you can open more beds, but you need the staff to staff them.
And there's a new study on how long your immunity might last after you get COVID and the antibodies you develop. What are you learning?
Well, I looked at the study, Mona. It's a small study. It measures IgG antibodies in people, and it showed that on average, the antibodies lasted for about 4 to 5 months. Now, this is just looking at the IgG antibody, which is only one of the many antibodies you need to help fight off the virus or to have immunity. Immunity is not only due to one antibody, but multiple antibodies and T cells as well, which this study did not examine.
Dr. Ali, researchers have also found that some COVID survivors' immune systems may end up turning on them, actually hurting the body. What do you know about that?
Well, we do know that the immune system gets activated in COVID infection, and it's not only the virus that causes the damage, but it's an overactive immune system causing inflammation of the lungs and of the heart especially.
And lastly, Dr. Ali, there's some interesting news on vitamin D and the role it might play in possibly fighting COVID. What's your take?
Well, people think vitamin D is the be-all, end-all in medicine. But, you know, the study that I did see did show that 80% of people who had COVID infection were deficient in vitamin D. But remember, Mona, people who have low vitamin D levels often have other chronic conditions such as hypertension, diabetes. And as we age, our vitamin D stores also get depleted.
Our thanks to Dr. Ali.